Welcome back to Healthier Business, protecting the physical and financial health of businesses with the new normal of COVID-19 here in the greater Kansas City metropolitan area. This is a webinar series sponsored by PhD Retirement Consulting, as well as the Better Business Bureau of Greater Kansas City. As we've mentioned, we're doing this particular third segment in our series as kind of a 3 sessions. So this one is the third of those 3 sessions. And today we've been talking to Dr. Ryan Jacobson. He's the medical director of Johnson County, which is one of the counties that makes up the greater metropolitan area of Kansas City. We thank you so much for joining us today, Ryan. I know that you're a very, very busy man. In fact, you're reaching us today from one of your offices, but sometimes you're here, sometimes you're working from home, sometimes you're in ER. Actually, you're a practitioner on the front line. So we thank you for your service and thank you for taking a few minutes to help get the message out about how we can all be keeping ourselves and our families and our businesses safe. So thank you so much.
Thank you.
A big question that has come up repeatedly, and so this is kind of our third session. We want to really focus on this idea. So many people are wondering, like, when are we going to be able to return to some sense of normalcy? When are we going to be able to return to work? Maybe separating facts from myths, because I understand some people say, you're not immune if you've had it. So maybe that's the first question is, if you've had it already, are you immune? If you've been exposed, might you be immune to the disease now? Is that even true?
So that's a good question, and we don't know 100% the answer to that. So there was a study out of South Korea recently that showed that the number of people that had been discharged after they had had a negative test for COVID and recovered, presumably clinically, and they were better, they had been retested and were positive for the virus. Now, there's a number of confusing things about that. One is that the test we use to see if you're infected is not the best test. It is a test that may have up to 30% false negatives. Meaning if you test 100 people who have it, 30 of them will have it and the test will show negative. So we don't know if the fact that they got tested when they left the hospital, that they were negative falsely, and they never really got rid of it and they would still test positive, and the next time they test positive. There are issues with the testing technique, how the test is transported, the type of media that is used to run the test. The sampling technique is important as well. So there's a lot of things we don't know. We always are guessing a little bit right now at this early stages if you have antibodies to it, if you are immune from getting it again, or if you are susceptible to getting it. And that is a question of great gray area right now that can't be answered definitively.
Well, yeah, that is interesting. I'm going to reference an interview with the CDC, and this was only yesterday on NBC News. I believe the interview was with the CDC director, Robert Redfield. He said getting back to some sense of normalcy is going to involve kind of 3 parts. Well, I shouldn't say he, but it's not a direct quote, but this is the way NBC reported it. First is the ability to test who has it. Second is antibody test to see who's had it and is now immune. And then the third is this contact tracking of trying to figure out those who do have it, who they might have interacted with. So this ability to test who even has it. Can I ask real quickly, are we still, is it still true that we don't have enough tests? Because I had heard for the longest time that there simply aren't enough COVID-19 tests. So has that been solved, or we still don't have enough tests in America?
There are still struggles with getting adequate testing supplies. We have continued to increase our access to those over the last couple of weeks. And we have now, in Johnson County, we have had access to more, specifically the health department. Other area hospitals are continuing to get access to tests. But again, the test needs to be taken. It also needs to be run on a machine. And those machines take a number of hours to run those. Some of those have a very high capacity, and they don't want to run those samples until they get full. And so there may be some lag time in getting results. And we are still in a testing phase in the sense that we want to test as many people as possible to get an idea what the prevalence in the community is. So we're beginning to do that more and more as the weeks go on, especially in the next few weeks. I think we'll continue to see a rise in testing, which will yield a rise in positives. So we will see more infections because we'll be testing more. But that does help us determine a little bit more about calculating the actual rate of infection and the prevalence in the community. So testing is incredibly important.
Yeah. Well, and we referenced this in our last session. Evidently, there were enough tests to also test a tiger at the zoo.
Right.
The second part of the CDC's comment is antibody tests to see who's had it and who's immune. So I'm gathering from what you're saying that the test to test if you have COVID-19 is different than an antibody test. Can you explain in really quickly, kind of layman terms, what we're even talking about there?
Yes, so the test to determine if you've got COVID infection is a different test that says yes or no, I am actively have that virus in my body detected currently right now. Again, there's limitations to that test. That 30% of the time it may be falsely wrong, falsely negative. That's different than the antibody test. The antibody test measures if you've made antibodies to that virus. So there's two different types of antibodies. One's called IgM, one's called IgG. And IgM signifies that you may have been exposed and had a recent infection with COVID. And IgG says you've had it and made antibodies. And those are longer acting antibodies that stay in your body for a longer period of time. So if you detect someone who has IgG or IgM in their bloodstream when they measure the antibody test, it signifies that they have had exposure to COVID. The problem is we don't have a lot of capability to rapidly test for that right now. And secondly, we don't know if just the presence of those antibodies being measured in the blood by that test means that you're immune from getting the disease again. We just don't know that. In theory, it's excellent an idea. And as we continue to ramp up testing, doing antibody testing on the general public and on essential workers would show us folks who've potentially got protective antibodies to COVID, therefore maybe rendering them safer to be exposed to COVID. And that is one of the discussions that's occurring about opening up the economy again. Again, it's very early and we don't have hard data on that, but that is one of the discussions that's occurring about antibody testing.
Yeah. Well, generally speaking, are you hopeful about the way that this is being addressed? I mean, are you encouraged about what you're seeing, maybe just here in this area of the country in Middle America? What are your thoughts?
It's really hard to answer that question. I think from the healthcare perspective, I think the hospitals, and I'll speak just to the region right now in Kansas City, have done a tremendous job of preparing. They have been canceling elective surgeries and procedures. They've been conserving and storing their personal protective equipment for the providers. They have generated a tremendous amount of capacity to care for any potential surge or growth in patients. So the hospitals have done a tremendous job on that, and I can't applaud them enough. Local county governments, local cities, municipalities have done a tremendous job of mitigating the risk with the stay-at-home orders and social and physical distancing. I think that's made a huge difference, and I think we are seeing a very different reality in the Midwest, in the Kansas City, than we are in New York or Louisiana, for instance. So I think we've done a great job here, and I'm hoping to continue, again, cautiously optimistic along this trajectory where we can begin to open up the economy again and get back to work and get things back to as normal as we can in a very safe and cautious fashion.
Yeah, well, and we're encouraged to, to think that that might be right around the corner. If you don't mind me getting personal, how are you doing personally? I mean, like, how do you keep your head up? And this is probably a really hard time. How are you and the girls doing? And how are things at home? And how hard is this battling through and just trying to remain positive and encouraging?
Sure, I think everybody's got cabin fever. I think the girls miss their classmates. I think my wife is enjoying less and less the company of tight quarters in the home, but taking it like a champ. I think it's difficult to socially isolate from your family and your friends. So I do think it's taking its toll on everybody. I think there's a fair amount of anxiety created about when is this going to relent, or when can we start seeing some progress be made in the economy as far as getting back to work and things of that nature. So I think there's some anxiety just in general, but overall I think we're doing well. And on the converse, I would ask you how you're doing, how your family's doing, and how your business is doing, and how folks are dealing with their 401ks as well.
Well, I appreciate you asking me. You said it earlier, but I've used this many times. I'm cautiously optimistic. I'm not discouraged. It's funny. Some people say it feels like what we're going through is almost like some futuristic, like science fiction movie. Like, it's hard to believe. I don't know that I'm looking forward so much as looking back. I'm currently reading American Lion, which is the autobiography of Andrew Jackson, our seventh president, and just a fascinating read. And in 1832, they dealt with one of the 7 pandemics of cholera outbreak right before his election. And so this, if you just know history, you know that these kind of things come and go, and the human race has survived many more challenging things even than this. And so I just continue to be cautiously optimistic that this too shall pass. Sure, yes, we're dealing with folks in their retirement plans, and many times I think it's just, you know, encouraging people to have a forward-looking hope, I guess, and not overcorrect in their 401k and make huge mistakes by moving everything to cash right now and things like that. So, you know, generally speaking, I think people are kind of holding on, but to your point of cabin fever, we're wondering how much longer we can hold on. But I think folks are doing okay. We're doing great here at home. It's so fun. I almost think you want to look for the daily gifts. You know, my little girl, she's in college, but my little girl's home, and she wouldn't normally be home in April. She would normally be away at college. What a gift that is, right? So recognizing the gift that you have each day and being grateful for that particular gift, and just being present, being where your feet are, and not being so looking forward to just saying, how can we get out of this? Like, when can we get out of this mess and move on? And that's challenging, because I think that is essential to the question of just even getting the economy open back up. It's what we deal with every day. So, hey, I appreciate you looking. Thanks for asking, Dr. Ryan, and thanks for all of you who are watching. And we're hoping that we're answering some questions. I know I've learned a ton today in terms of whether I should or shouldn't wear gloves, and the peak or the smoldering of what's happening here in Kansas City. So you'll want to check out our first 2 sessions. All of these are available on YouTube. You might want to subscribe to our station out there. Also a good time to be following on all the social. So we're on LinkedIn, Instagram, Facebook, Twitter. My Twitter account, by the way, is @repurposement, which is also the name of the book that I've written. It's there on the screen. So thank you so much for watching. Thank you for your time today, Dr. Ryan. And we do appreciate all that you're doing on the front lines and keeping all of us safe. And hang in there. This too shall pass. I guess I share that sentiment. So thank you so much. Have a great day.
Thanks.